Good afternoon, all. Myself, Dr. Dinesh Chavhan. I am an associate professor in neuro department at Sanchit College of Physiotherapy. Today, we are going to discuss about the reflex assessment. So, in that, we are going to see the detailed reflex assessment of both deep and superficial. So, objective is to know what is the reflexes, what are the types of reflexes, then what are the reflex arc, then how to do assessment of reflexes. So what is reflexes? So it is an involuntary effort response due to sensory stimulation. Okay, see here, involuntary response of effector organ. So what containing reflexes arc? So in anatomical nervous pathway, it contain like 5 components. Okay, so very important here. First is receptor organ. Okay, to receive that stimulus. So receptor organ first. Then to carry that stimulus till your center is afferent nerve. So afferent nerve carries the information till the center, and then center. So actual information perceive and then interpret, and that information goes to efferent nerve, with efferent nerve to the efferent organ, and then we'll see the response. That this is what the reflex are follow when we test the reflexes. Okay. So what are the pathway for that? So skin for superficial, for a deep, it's a tendon. So that means the first information received by the reflex in the reflex up by the skin receptor. Then with this, the afferent goes to center with the sensory neuron. So with the sensory neuron, we'll see afferent goes with the type 1 or type B. Okay, 1A, 1B. Afferent goes. Then interconnection with the association neuron at the center spinal cord level. Okay, and then it goes with your motor neuron, that is alpha and gamma, to the muscle, and then we'll see the response. This is the nothing but the reflex arc. So on this reflex arc, there is an influence of UMN, that means upper motor neuron. So when there is a UMN lesion, what type of reflexes, or when there is a element lesion, what type of reflexes? So we'll discuss later. So this was the R. So what are the types of reflexes in superficial? So plantar reflexes. So what is the root value of it? Plantar reflexes. So plantar reflexes root value is L5, S1, S2. So here we'll see plantar reflex. Abdominal reflexes, what is the root value? T7 to T12. Okay, so this is the root value for the abdominal reflex. Then cremastic reflex very rarely practiced, but it's very important because it's one of the reflex tells about the when patient came out of spinal shock or not in case of spinal cord injury. So cremastic reflex is L1, L2 is a root value. Then anal reflex, yes, anal reflex is very important. Again, very rarely practiced, but it's very important to know to find out whether patient has came out of spinal shock or not. Okay, so the root value is S3, S4, S5. Okay, then corneal reflex. So corneal reflex, again the superficial reflex we test at the corneal. So these are the 5 reflexes. We'll see how to elicit. Okay, so in that we'll see mainly focus on the plantar reflex, abdominal reflex, and corneal reflex. So what are the deep reflexes? So deep reflexes is basically your upper limb bicep reflex. So root value is C5, C6. Then tricep reflex, root value C6, C7, C8. Supinator reflex, C5 and C6. So these are the 3 reflex. It's a deep reflex we do for the upper limb. And what are the deep reflex for the lower limb? So knee reflex, again it's called as knee jerk. So what is the root value? L2, L3, L4 is a root value for the knee reflexes. Okay. Then ankle reflex. So ankle reflex, again the root value is L5, S1, S2. Okay. Then jaw reflex. So for a jaw reflex, the afferent goes with your trigeminal. Okay. So basically the action of masseter we'll see. So these are the deep reflexes we regularly practice when we evaluate the patient. Okay, so we'll see these are the reflexes in the video in later. So what are the importance of reflex testing? So reflex testing is very important to know. Okay, importance is to test the integrity of reflex arc. As we saw the reflex arc, so there are 5 components in the reflex arc, as we know from the afferent, afferent nerve, receptor, afferent nerve, center, effector, efferent nerve, and effector organ. So these are the basically the integrity of the arc when we test the reflexes. So indirectly we know that what is the integrity of the arc, where is a lesion. Okay, so next is check whether the sensory or motor component are working or not. Okay, so that means whether the ascending, the information is ascending your center is the problem, or efferent organ. Okay, so is there Lemon lesion, that means lower motor neuron lesion, or UML lesion, that means upper motor lesion. Okay, on the testing of reflex arc, we come to know broadly that yes, it's a Lemon lesion or it's a UML lesion. Yes, to detect the level of lesion, as we already know that each reflex has their own root value. So when we see, if when we assess the knee jerk, as we know that L3, L4, L5 is a root value for the knee jerk. That means if knee jerk, knee reflex is diminished or absent, that we know that the root value involvement is L3, L4, L5. So these are the on the basis of reflex assessment, we come to know what is the level of lesion. So to detect the effectiveness of the treatment, yes. So reflex testing can be used as a purpose of, again, assessment. Okay, to know where is the lesion. Okay, to know, okay, the level of lesion. And next is, again, to check when there is a treatment, if you give the period of like 10 or 15 days after the treatment, if you are testing the reflexes, and if you see the reflex is normal, that means good. The if it was absent, now it's showing the normal, that means yes, treatment is effective. Okay, so on the basis of testing the reflex also, we come to know the grossly that yes, our treatment is effective. So reflexes can be used as assessment purpose, reflexes can be used as a treatment purpose. So what are the grades of reflexes? Okay. So grades of reflexes, absent, it denoted as minus. Okay. So then diminish, okay, it denoted as a 1 plus. Normal is a 2 plus. Breaks is a 3 plus. Okay. Exaggerated is a 4 plus, and clonus. Okay, so these are the gradings of reflex testing. So on the basis of grading, how we come to know whether it is LML lesion or UML lesion? If it is absent or diminished, the most of the time you will see the repeat in case of LML lesion, absent or diminished. Okay, if it is brisk or exaggerated, the lesion will be the UMN lesion. Okay, so these are on the basis of reflex testing, we come to know grossly, okay, what LMN or UMN lesion, or clonus, it itself, a clonus will show UMN lesion. Okay, so these are the grade we have to do according to the assessment. When we do the actual assessment, we come to know that what are the reflex comes in which category: absent, diminished, normal, base, or exaggerated, or clonus. So now we'll see superficial reflexes, how to elicit the superficial reflexes assessment. Okay. So abdominal reflex, the root value is T10 to T12. See how to elicit the abdominal
So now
reflex.
we'll see the examination of abdominal reflexes. So abdominal reflex is a superficial reflex. So we will use rough object. Okay, it has to be a rough so that it won't hurt to the abdominal area. So now the superficial reflex from T8 to T12. Okay, so all quadrant we have to do the movement. Yes, so we saw the umbilical indrawing. So this is the normal reflex.
Yes. So as we saw the abdominal reflex, okay. So you have to elicit from all four quadrant and we'll see the response is indrawing of umbilicus. That means it's a normal reflex. Now we'll see the plantar reflex. The root value for plantar
So now we'll
reflex
see plantar reflex, which is superficial
L5
reflex.
to S.
So examination for it, supine line position. Okay. So foot is in neutral position. You have to hold proximally, stabilize. Okay. So with the help of a blunt object, so we have to scratch from middle of the heel to the ball of the great toes. So see the response.
Again, see in the plantar reflex, when it is positive, that means the Babinski sign is positive. That means the extension of the great toes and fanning of other toes with this dorsiflexion. Okay, that's called as Babinski sign positive. Babinski sign negative, that means a great toe flexion. Okay, with this crowding of the other toes and plantar flexion. This is called as Babinski sign negative, or the plantar response is normal. Okay, so we'll see now corneal reflex.
So now we'll see the corneal reflex, which is superficial reflex. Okay, we have to stand just beside the patient. Okay, and we have to touch to the cornea. The response is closing of the eyes.
Yes. So here in corneal reflex, if you see, you have to laterally, okay, touch to the cornea, and the action will be the closing of the eyes, or as per the model patient to look at the front, and you have to do with the cotton, you have to just touch the corneal part. The blinking of eyes is the normal response. So these are the superficial reflex. Now we'll see what are the deep tendon reflexes. So for the upper limb reflexes,
Okay. So now we'll see the bicep reflex, which is deep tendon reflex. So first we have to palpate the bicep tendon with the passive movement. So popping tendon up. So it's 30 degrees of flexion of the elbow. Palpate the tendon and then we have to hit on the thumb. So we'll see the responses.
yeah,
Flexion.
yes. So in bicep reflex, you have to palpate with your finger or tendon, because it's a very dedicated structure around the bicep groove. That means your the around the structure is your arteries and your nerves. Okay, so when you are palpating there, so it has to be very precise, otherwise you may hit to the brachial artery and that can damage. So that's why palpate on with your finger, and you have to hit on the nail bed of your finger. Okay, now we'll see the tricep reflex.
So now we'll see the tricep reflex, which is deep tendon reflex. So for it, it has to be flexed little bit the elbow, then supported with my hand. So I'll palpate the tricep tendon, and then we have to hit on the tendon. Yes, we'll see the responses extension of the elbow.
Yes. So if you see the
So now
tricep reflex, the position in the supine line, you have to flex the elbow and then you have to palpate the tricep tendon, you have to hit on the tricep tendon, you will see the action is extension. So normal response.
So now we'll see the supinator reflex, which is deep tendon reflex, just the proximal to the radial styloid, okay, 7 to 10 centimeter. Yes, so response is
Yes, so now you see the responses here, the radial deviation and supination. Okay, so when you perform, it has to be up of the radial styloid 5 to centimeter, the normal response.
So now we'll see the jaw jerk. Again, it's
Jaw
the
jerk.
deep tendon reflex. Okay, so we have to keep the thumb on the jaw and ask patient to little bit open the jaw, and you have to hit. We'll see the action closing of the jaw. So now.
Yes, you have to little bit open the mouth and then when you're eating on the chin, the action is closing of the mouth. This is the normal response. Now we'll see the knee reflexes.
Okay. So now we'll see knee reflexes. Again, it's called as knee jerk. Okay, which is deep tendon reflex. We have to first palpate the patellar tendon, which is just above the tibial tuberosity and below the inferior pole of the patella, soft padding. Okay, so we have to hit with the hammer. So we saw the response knee extension, yes, which is normal.
So here your very important palpation of patellar tendon, that means just above your tibial tuberosity and below your inferior pole of patella. So that soft padding is patellar tendon. There you have to hit and you will see the responses extension. So now we'll see if patient is not able to sit, then how to do in supine line or the same reflex for knee reflex.
So other position for testing knee reflexes, those patient is not able to sit, okay, independently. So those are lying down. There also we can test the knee jerk, okay. So for it, first bend the knee, other knee, okay. Bend this knee, hold this position, just relax, okay. Then we have to palpate the patellar tendon just above the tibial tuberosity, okay, and there we will hit. Yes, so
Yes, so those patient is not able to attain a sitting position, for them in a supine line also we can perform. So we have to flex the other leg and keep the hand on the other leg and we will perform as we saw in the video. So again, those patients is not able to
the knee reflex testing. Those patient is not able to sit
sit
independently
for them. Again, what is the alternative
If
position?
it is heavy limb, it's not able, it's difficult to lift up. So for that, we just abduct the limb. Okay, relax on the knee. We already bend. So just we have to palpate this above the tibial tuberosity soft padding. There we have to hit. Okay, so we saw the responses extension of the knee.
Yes. So again, those patient is not able to sit, for them how to do in supine line position. This was the alternative position. Just you have to abduct the leg and then hang side of the bed and you have to do the reflex assessment for the knees. Very good position to perform without lifting, because the knee is again the heavier The lower limb is a heavier part. If it is paralyzed, again it's very difficult to lift. So this is the best way we can perform the knee reflexes. So now we'll see the anchor reflexes. Okay, L5, S1, S2 is a root value.
3. Okay. So now we'll examine the ankle reflex, which is deep tendon reflex. Position for it is supine line. So now test position. So knee flexion, dorsiflexion of the ankle. We'll keep on the other scene of the tibia. Okay. So dorsiflex, then palpate the TA, tendon Achilles. We have to hit on the TA, which is perpendicular with the hammer. Okay. Yes. So now we'll see the response is dorsiflexion. Thank you. 3. Okay.
Yes, so anchor reflex, for it the position is supine lying position. We have to bend from the knee, okay, then little bit dorsiflex the ankle, and we have to find out the TA tendon, and then we have to hit on the TA tendon in such a way that the perpendicular to your alignment of the tendon. So if it is little bit plantarflexion, that means it's a normal response. So these are the reflexes very easily performed on the patient. Yes, so we are at the end of the reflex testing or reflex assessment lecture. So in the summary, if we see the superficial lip reflexes and the deep reflexes, so in a short, in a one go, if you want to see what are the superficial reflex, what are the deep reflex, yes, again superficial reflex, plantar reflex, the root value is L5, S1, S2, abdominal reflex, okay, T7 to T12, okay, cremastic reflex, again L1, L2, again cremastic reflex, we have not saw the videos of it, but again it's a very rarely do every day, because it's a again very important, but it's to know in a spinal cord injury whether patient is came out of shock or not. For that purpose we do cremastic reflex. In cremastic reflex, actually you have to scratch the inner thigh, okay, inner thigh in the groin region, and you will see the testicle movement upward. So that means yes, the reflex arc is a intact, okay, and that itself suggested that the spinal cord injury is incomplete spinal cord injury. Anal reflex, you have to actually scratch around the anal area, okay, and you will see the anal movement, okay, and yes, so that means a sacral sparing, that is S3, S4, S5 root value, that means the arc is intact. Again, it tells about us the spinal cord shock. Patient came out of spinal cord shock, that means incomplete spinal cord injury if it is anal reflexes intact, okay. And corneal reflex, as we have saw, okay, when we touch to the cornea, closing of the eyes. Then deep reflexes, so biceps reflexes for upper limb we have saw, okay, tricep reflexes again we have saw, and supinator reflexes. So these reflexes can be done in supine, and this can be done in sitting also, not necessarily always a supine. If patient is sitting, you can do in sitting also, okay. Knee reflexes, we have saw the alternative position for the knee reflexes is patient ideal good is patient in sitting position, that is the ideal position, and leg is hanging, so its patient is relaxed position, okay. And after this, if patient is not able to attain the sitting position, then you can do in a supine line also. We have already discussed what are the alternative position for the supine line position, okay, with the hip knee flexion, or just take the leg out of the bed, abduct, and then perform, okay. And anchor reflex, yes, we have discussed. and jaw reflex. Okay. So one more thing here to mention, that if when you are doing the reflex testing, patient is not performing, that means patient is stressed, sometimes holding. Okay, if you feel that patient is not relaxed, so you have to divert the patient attention. That means something you have to ask the patient, yeah, how are you, what you eat in the morning, so you can something ask, so that they get engaged, they are diverted from concentration, and you can perform elicit the reflexes. If not, then valsava maneuver, that means you have to hold like this, ask patient to hold with this and clench the teeth and then perform. Okay, this is the valsava maneuver we perform, okay, to divert the attention of the patient. Okay, so with this we have done with the reflex testing, assessment, okay, and summary also. So thank you so much for your kind attention. Okay, I thanks to our to our Sanchiti group, Dr. Parag Sanchiti, chairman. I thanks Mrs. Manisha Sangvi ma'am, executive director of Sanchiti group. I thanks Dr. Apurva Simpi sir, who is the principal of Sanchit College of Physiotherapy, and I thanks all the physio team for giving us such opportunity. Thank you so much.